My name's Travis Alexander. I'm a postdoc in medical humanities at Rice University, where I work on the Translational Humanities for Public Health project. And today we're joined by Laura Mauldin, who is an associate professor in women's gender and sexuality studies, as well as human development and family sciences at the University of Connecticut. Dr. Mauldin's project is going to be discussed today. It's featured on our website. It's called Left in the Care of One, Spousal Caregiving in the Age of COVID-19. And so with that in mind, Laura, if you could just tell us a little bit about your academic background and how you came to be doing this work.
Sure. So I started my graduate work really at Gallaudet University in Washington, D.C., and that's the only liberal arts college for the deaf in the world. So everything is conducted in American Sign Language, and I obtained a master's degree in deaf studies. While there, I worked a lot in disability studies, which is a broader, larger field than deaf studies, but they're sort of connected. And when I finished my master's degree, I wanted to continue thinking about how we think about disability, sort of broadly speaking, rather than that more of a narrow focus on deaf communities. And so I went to get a PhD in sociology, partly because I was really interested in understanding how medicine and medical knowledge frames how we think about disability, broadly speaking, that is how people tend to see disability and then think about it in medical terms, or think about it in terms of impairment and deficit. And that kind of powerful kind of knowledge, medical knowledge, was what interested me as to why that dominated people's perceptions of disability, because I grew up with deaf friends and learned sign language in school and from my deaf friends, and felt like that wasn't at all how I saw deaf people. I didn't see them in any way, shape, form, or fashion through a medical lens. They were just my friends, and it was a community and culture that I was part of. So when I finished my master's degree, I went on to get my PhD in sociology, specifically medical sociology, was my sort of area of focus, again, because I was really interested in how healthcare systems operate, how they respond to disability, how medical knowledge dominates what we think and perceive about disability. So I was just really interested in medical knowledge, writ large. And as I pursued that degree, I was trained by Barbara Katz-Rothman, who's a very well-known feminist sociologist who studied motherhood and technologies and disability as well. So this really shaped how I went forward in thinking about how disabled people and their family members, for example, might respond to disability through interactions with the healthcare system. So this led to my dissertation, right, which was on deaf children and the parents, in particular mothers, who obtained a cochlear implant for their deaf child. So I really looked at and followed mothers through the whole process. So we have certain systems set up to respond to disability in the US, and they're funded by the government, from the NIH to, setting healthy people, they have goals, right? So in Healthy People 2020, for example, one of the goals was more cochlear implants for more deaf children. So we have sort of mandates and funding from the federal level that then trickle down to states. States have early intervention programs. Then, of course, cochlear implant corporations have their product, and then cochlear implant clinics, of course, are selling the said product. And so I was really interested in sort of that whole process, milieu, if you will, about how parents moved through that and how they understood deafness through all these major systems that we have set up to respond to it. And after I finished that book, what later became a book, I sort of broadened my research agenda. I still do work that has to do with deaf communities, and particularly around cochlear implantation in deaf children. But I really wanted to expand beyond that to disability more broadly as to how our systems respond to disability or don't, how our culture um, represents disability, and how people are pressured to give care for disabled people in a particular way. So, what I mean by that is the ascendance of the cochlear implant sort of transformed what good care was defined as for deaf children. That's just a specific example. But there are many other medical technologies that have changed many other people's trajectories with regard to care, depending on their disability. We have all kinds of new medical technologies that let people live longer with more complex conditions. And so we are also reliant on family caregivers to engage those technologies and engage in that care. So to me, I going from the specificity of deaf communities to the broader question of disability as a category didn't feel like much of a leap. And the same themes were showing up, right? How we think about disability, how ableism operates in our systems, and how we expect family caregivers to care for disabled people in the absence of systems. Like lots of, for example, with home care, we have, paltry systems when it comes to home care. So I wanted to look at how, family caregivers are the system. They sort of are unpaid and hidden. So they're the system. So that's like that was a very long answer, broad stroke of how I got from one set of, research agenda to another.
Yeah, that's really fascinating. Could you talk a little bit about some changes in the nature or environment of caregiving that have happened in the wake of COVID-19 or ongoingly are changing?
Sure. Well, I'll say the project that's specifically looking at family caregivers focuses on spouses. There are all kinds of family caregivers, but I was focused specifically on spouses. And I should say that this was supported by the Social Science Research Council. So they did fund this study. Excuse me. They did fund the study. And what I basically did was I asked questions in interviews, and I did interviews with 44 people across 22 states, and I did home visits with 4 of those. So I had home visits with 4 different couples across 4 different states. Um, and the questions I was asking, particularly in interviews, had to do with the pandemic has happened. How has that changed your caregiving? What's different now for you? So that was one line of thinking about that. The other was, in what ways has the pandemic either improved or deteriorated your life further? So for a lot of, I'll just give you an example. For some people, there was improvement in the sense that things were shifted online. And so now, someone who's a caregiver for their partner, if their partner couldn't leave the house, they couldn't leave the house. And so if they wanted to listen to an opera, they could now do that online. Or if they wanted to attend a church service, they could now do that online together. So those were some of the, shifting to virtual events was actually a positive that showed up sometimes. But then at the same time, a lot of people who had home health aides, this was a major theme. People who had home health aides coming in when the pandemic hit, they asked them to not come anymore because of the precarious work conditions of home health aides, which means that they're paid so low, they're often working across more than one family. So there may be cross-contamination, for example, and their employers didn't provide testing or time off and things like that to maintain safety. So this was considered dangerous for like family caregivers. Sort of in their calculus were like, this seems dangerous to have people come in this context. So I'm going to now take over 24-hour care for my spouse or partner. And this was, as you might imagine, absolutely exhausting and tiring and terrifying all at once. So I have many stories of people telling me very harrowing details about things that they had to handle on their own, including hospice care.
Could you talk a little bit more about you mentioned you conducted these interviews in home across a number of different states.
Yeah.
I wonder if you could just talk about how you settled on that particular method.
Oh.
What do you think the value of the geographical diversity is, doing the interviews in home and kind of like a almost field work?
Yeah, this is actually such a great, I appreciate this question so much. I love talking about methods. And my this involves saying what I originally planned to do and then what I ended up having to do because of the pandemic. So originally I had fieldwork approved to have everything done in person and locally. So because I live in New York, and I guess I should also mention, I arrived at this topic of spousal caregiving because of my own experience caring for my partner for years before she passed away. And so I decided, as I was thinking about disability and care, just broadly in my research, I wanted to look at other people's experience of spousal caregiving. So that's how I landed on that specific topic. But because of that personal experience, I had connections to support groups and communities in New York City. And so my first idea was then to use some of those connections to recruit people locally where I would go and spend time with people. And we had an aim of maybe 10 families or so to really kind of dig in and spend a lot of quality time with them. So I had this all ready to go. And then, of course, the pandemic hit, and that meant no going to people's houses, particularly people who are, ill. Some people are terminally ill, some are chronically ill. I mean, a range of things. It would not be safe anymore. So I had to really rethink what I was going to do. And so I decided that, along with many other ethnographers or qualitative methodologists, that I was going to have to shift online as well. So what I did was, instead of recruiting just locally, I recruited online through support groups on Facebook. And that meant that my sample became national at that point. So I ended up with, I think, just maybe 3 or so people in New York City, but everybody else is, flung far and wide across the country, and that's fine. And so I did essentially video interviews with people, and I did a series of 2. So I would interview someone first, and then I would give them an assignment. And the assignment was to take photographs of all of the objects, the technological objects, or anything that they consider important to caregiving or providing care. And so this could be broadly interpreted. And so what they would do between the first interview and the second interview is collect these photographs, send them to me. And then in our second interview, we would discuss all of the objects and all of the things that they had indicated were important in care. And so I would ask them a lot of questions about that. It was also a way for me to visually get into people's worlds, because as an ethnographer, this is what we rely on, is going into people's spaces and being with them. And absent that, I had to kind of find a creative way to be with them. And this was an idea I had to try to mitigate the effects of the pandemic and to have a little bit better idea of their worlds. So after a follow-up interview, or the second interview, and discuss the technologies and photographs, that was it for most participants. And then I chose a subset of people to ask if, once things calmed down and vaccinations happened. So I was in touch with people I have been in touch with many of them for 2 years now. And once things kind of calmed down and vaccines happened, I asked, would you be open to a home visit for me to come and actually spend time with you as the caregiver, but also your spouse? And this meant that the subset of people that I chose had to be able to consent. So there were some pretty strict guidelines around, who I would be allowed to visit. And so I selected people who I thought matched that criteria. And of the people I asked, about half of them said yes. And I then did home visits with 4 people. And I would travel, flying or driving, whatever, had to be done. I stayed over in some instances, sleeping on an air mattress or what have you, to observe their daily lives. So I think the study design actually panned out quite well, given the circumstances, but it's a real example of having to learn how to pivot and think differently and think creatively about how to understand people's lives when we can't physically go to them.
Yeah, absolutely. So maybe just by way of a conclusion, could you point us to some places where this research is going to be coming out, or where we could find it over the coming months and years?
Sure. Thank you for asking that. I currently have a few things out in the form of public scholarship. So I'm really keen on writing about these ideas for the public. So I have an op-ed in the American Prospect, which is called "The Care Crisis Isn't What You Think." I have a short piece in a blog for Caring Across Generations, which is a national caregiving organization. So they do a lot of work supporting caregiving. And I did write a brief write-up of the study for them. I also have a public blog post on the Social Science Research Council's website. They have a blog called Items, so you can find it there. And I'm currently trying to find an agent for the book that I have about halfway written. And it will be a narrative nonfiction written for a general audience. So this is a book that will be written accessibly and will incorporate 3 things: research, cultural commentary, and memoir. So I'll have 3 of these things sort of woven together into a nonfiction book. And I have a personal essay, a memoir piece coming out in the Los Angeles Review of Books in August. So there are things coming. I'll certainly be publishing more, sort of COVID specific research in academic journals. I have a wonderful team of research assistants who have been coding data, and so we're working on that. So I've got a wide range of public scholarship and narrative nonfiction, general audience book, as well as academic articles.
All right. Well, I look forward to checking out some of that stuff myself. Thanks again for coming in and talking with us today. And if you're watching these videos, we'll look forward to posting another one soon.